Hi, have you ever wondered what Hydrafacial is all about? Well, I'm going to show you step by step today a platinum Hydrafacial treatment. My name is Amy Dvornick and I work with Warrenton Dermatology. I've been in aesthetics for over 30 years in all different aspects. This is Angie. We just did a live on Facebook, half of her face on Facebook, this half. Now we're going to do the other half on Instagram. Now, I want any of you to comment or ask any questions, because anybody that asks any questions is going to be admitted into a door prize, and we'll be doing the door prize after the video's over.
And what do they win, Amy?
Oh gosh, a free Hydrafacial, of course. Yay! All right, so I just start off with a basic manual cleanse, and I'm just going to do the other side too because I haven't done any of the serums on her face. And I'm going to walk you through the whole thing, all of our options that we have, including lymphatic drainage, all the boosters that we have, and the LED lights. So once we get this off, we're going to start with the lymphatic drainage. The lymphatic drainage is awesome. It helps pull the the bad lymph out of your face, and then just puts it into your system to go through your kidneys and out your urine. So, oops, grabbed the wrong one. Here we go with the lymphatic drainage. I'm just going to be really brief with it and show you quickly what we do, but really we do the whole face, and it takes about 15 minutes, and it is the most wonderful treatment. It just feels like a massage. So again, we're on 3 right there. What we do is we start right here, pulling, pumping, pulling, pumping, pulling, pumping, and out we go. So we do 3 times in each area. It also really helps for, women who are about my age or younger and older, to pull up their fine lines. It really does. It makes a huge difference. I have patients that get lymphatic drainage each time, and it really, really improves the texture of your skin and those fine lines.
So, Amy, it helps to reduce puffiness, reduce inflammation, get the fluid out of the skin.
Absolutely. Dark circles under the eyes. Plastic surgeons love it when you do this prior to any facial plastic surgery, because you have less downtime and you're going to heal faster and you don't have as much bruising. So as you can see, we just go through the whole face and continue moving it all out. And you can imagine if it's 15 minutes of that, what a wonderful feeling it is. Okay, so now we're going to wash this off. And then start off with the Hydrafacial treatment. The first step of the Hydrafacial treatment is the cleansing and exfoliation. And again, this is not microdermabrasion, it's a replacement. It's going through all 5 layers of the epidermis, cleaning the skin from the inside out. It goes to the transdermal junction, so it really does clean from the inside out. You want to just do this and then not clean your face for the rest of the day. Just enjoy the moment. So here we go. This has vortex fusion in the tip, if I didn't already mention. The vortex fusion is what delivers the serum through all 5 layers. Okay, you can see the serum coming out and going into the skin. Lovely. And it feels kind of like a cat licking your face, don't you think, Angie? A cat licking your face. I've heard that a lot. Okay.
So, Amy, I remember when I used to get microdermabrasions, my skin would almost feel like it had been sandblasted or sort of torn up a little bit, just trying to get that dead skin off. So this is just doing it gently with high pressure water, is that correct?
Well, it's not just high pressure water, it's serum, and this serum has peptides and glucosamine and a plethora of other ingredients in them.
Nutrients.
Yes,
Yeah.
and but the microdermabrasion has crystals, and it tends to be a little bit more messy. And this just gently cleanses and exfoliates, and then we add on a peel. Now, the peel is a glycolic salicylic acid peel, and I'm going to be doing that next. The peel is not the kind of peel that makes your skin flake off. It's the kind of peel that softens all that dead skin and the sebaceous filament in the T-zone. Okay, everybody has it. Even though Angie is so young and beautiful, even she has a little bit of sebaceous filament. Everybody has it at any age. And what we do with the glycolic salicylic acid peel is we just put that on, let that sit on for a little bit. I won't do it for the video, but we let it sit on for a little bit to help activate it. And then we do something called vortex extraction. And vortex extraction is literally vacuuming off and off the dead skin and out the sebaceous filament.
So basically you're getting both a manual exfoliation and a chemical exfoliation.
This is manual and chemical, yes. Good question.
And why do we want that exfoliation? It clears the dead cells. Why? So we don't get blackheads and...
Well, any type of congestion. And you know what else is going to help with the congestion is that, is the lymphatic drainage. Sorry. The lymphatic drainage helps with the congestion too. See the congestion in the nose? That's called sebaceous filament. And we're going to try and get that to just vacuum right out. And yes, chemical and mechanical treatment. No downtime with this, people. No downtime. Any skin type can get it. Okay?
And I'm going to pop right to the back of the machine here and kind of show where all that fluid is going. Look at that. That is the dead skin.
Nice.
All down in there. All that came right off this beautiful face.
I know, she is so pretty. But I will tell you, if any of you are on Accutane or retinol or anything like that, or if you have a sunburn, you better not be getting hydrofacial treatments. Number one, you can pull back from the retinol 3 to 5 days ahead of time. If you get canker sores or sores around your mouth, you need to get Valtrex. And start with the Valtrex 3 to 5 days before the treatment as well. If you're on Accutane, no, because what's going to happen if you're not honest with your clinician is that your skin could literally vacuum off, and we don't want to do that. So that's why you have to be honest. And again, the retinol, pull back with that. Okay, now we're going to do the vortex extractions. This is the fun part. This is the vacuuming. So this is going to vacuum out all of the dead skin cells and the sebaceous filament that we just softened up. And you can see the fluid coming in as it's sucking out all of that sebaceous filament and dead skin. You want to go along the mandible and in the T-zone. We tend to lean up against our chin, put our hands on our face, things like that. So you want to make sure to get that mandible bone. And then really in the nose. Are you okay, Angie? Are you doing okay? All right. Tell me if I'm pressing too hard, okay?
Okay.
And you can do like a kiss and twist. See, I just got a nice little chunky sebaceous filament out of there. Nice. Okay, and now up to the forehead with the vortex extractions. Now, the next thing I'm going to do on Angie is an add-on. We have several different types of add-ons. We have an add-on called a perk. There's a perk for the lip and a perk for the eye. And what the perks do is they go in for the mouth. It goes in and exfoliates all the dead skin around the mouth and inside the mouth, and it also helps plump the lips. Around the eyes, it goes inside the orbital bone, vacuuming off dead skin again, but then infusing serum under the eye that is going to penetrate peptides to help reduce puffiness and dark circles. So those are the two perks that we have. We also have another perk called not a perk, but an add-on called Brightenol. And Brightenol has albuterol and vitamin C in it, and it's a whitening agent. So I think, there we go. It helps fade, like right here. Angie has a little bit of hyperpigmentation, dark spots here. She says it gets dark in the sun. So we're going to try and even that out with the Brightenol. You do have to use it on a regular basis. It's not something that's going to be one and done. Hydrafacials are a repeated skin wellness program.
So Amy, can you maybe tell our viewers about the package that's available as part of the open house?
Absolutely. We have an open house coming up October 26, 27, and 28. And we have a Hydrafacial package. You're going to be getting 4 treatments for the price of 3, plus you're going to be getting a perk add-on and a booster add-on. So you can do, oh, that leads me to the other boosters we have. We also have the Derma Builder booster. This booster is great. We call it our red carpet treatment. It's loaded with hyaluronic acid and peptides that they use in fillers, but it's not a filler because it's not injecting, it's infusing. So what you're going to be getting is plumpness for like 3 to 5 days. And then we have the Hydrafacial Connective Tissue Growth Factor. This is awesome too. It's a human growth factor, and we're all looking for those these days. All right, so those are the 3 add-ons that we have, and we're just going to finish up here with Angie's Brightenol add-on. Another add-on that's going to be coming up here are LED lights. Now, LED lights have a multitude of benefits. We have the blue LED lights that help kill bacteria in the skin, and that's great for people with rosacea or people with acne or post-acne scarring. The Brightenol is also good for post-acne scarring as well. So once we put this booster on, we can come in and penetrate it even deeper with these lights. Now these are the red lights. These are anti-aging and healing. So if I wanted to, I could do this for a little while on Angie. Even though she's young, she still wants to do anti-aging. Okay, and then I could come in and do some of the blue lights on her, which is for the bacteria that you get in any type of breakouts or acne or rosacea as well. So I'm going to do, I just did the add-on. I'm going to do the anti-ox, which is the final step of the Hydrafacial treatment. The anti-ox is loaded with hyaluronic acid, which is a molecule that holds 1,000 times its weight in water. It also has 4 different peptides and premium antioxidants. So this really hydrates your skin, and again, it boosts those lines too when you get those fine lines. And honestly, people, I have patients that get these on a regular basis, and it has improved the texture of their skin, and people notice. People notice. They're not sure what happened and what's going on, what you're up to. It's kind of like your secret.
Well, that's the best part, right, Amy? Like,
oh,
you
yeah.
get all of these benefits, and there's literally no downtime.
No
you
downtime.
Look glowy and beautiful after.
Yep, no downtime at all. I'm going to keep that on. I'm going to just do some more lights on here to help penetrate that. Now, again, we did one side here on Facebook, and we're doing the other side here on Instagram. In fact, I'm just going to keep filling some more hyaluronic acid on this side Because your skin will absorb as much as it can until it sits on top of the skin. Even it out.
How often do you recommend getting a Hydrafacial?
Well, Hydrafacial says get it once a week. I agree, but not all of us can afford that. Oh, no, once a month, sorry. Yeah, live, here we go. Once a month, but I tell people, you know, every 6 weeks or so. Not everybody can afford it every month.
Well, and that's why the packages are amazing, because when you get 4 as a part of your package for only the price of 3,
Right,
you can come seasonally,
right.
you could come every other month, or you could come monthly.
But don't come with the sunburn.
Well, no, so, but that's a way that you can very easily fit it into your budget.
Yeah, absolutely. The packages are great, and we usually have 2 events a year. And like I said, our fall event's coming up on October 26th, 27th, and 28th. It is a call-in event only. You don't have to come in. In fact, please don't. We're on regular work days. We have people manning the phones. I'm going to be manning the phones one day if you have any questions. So, yeah, definitely come to the event. Make sure you make your comments or put your questions up on Instagram right now, because then you're going to be entered in a door prize. Hello, thank you. Okay, so you can always go to warrentondermatology.com for any other questions, or you can call us on the phone. But make sure you come to our event or call to our event.
So
Come on
Amy,
in.
as we wrap up here, what are the final steps before Angie's ready to head out?
The final steps is I usually put a serum on, depending on what their skin is like. I use the IS Clinical serums and the Isden serum, Melatonic, which I love. It's one of my favorites, and it's going to be 20% off. All our products are going to be 20% off during our call-in event. So if you have any questions about products, you guys can call too. Always do your home care at home to repeat the benefits. Also, Elta MD. Elta MD is the sunscreen that we use, and it is amazing. I use this every day. I do not wear makeup. I put on the Ulta MD tinted sunscreen, and that's it. It doesn't sit in my lines, right, ladies? We all know that makeup doesn't sit in my lines or my pores.
Well,
So,
thanks, Amy. So
well,
I think
you're
that's all
welcome.
the time that we have, but thank you for showing us all about Hydrafacial.
Okay, and look at our lovely glowing. She doesn't have her sunscreen on yet, but mind you, she will have it before she leaves here.
All right. Thanks so much, Amy.
Thank you for sharing your time.